Assalamu alaikum dear doctors. In this video I am discussing recall communications. So the task are number 1, headache. Mom wanted the brain scan but history of tension headache. Explaining why not necessary and referred to headache clinic. Number 2, tension headache explained to the father of a 10 years old boy. Number 3 task is that scenario of a 15-year-old who had been seen previously and diagnosed with tension headache by your consultant and has come back for discussion and follow-up. The patient had come alone. Talked through the diagnosis of tension headache, no need for further investigations and no underlying serious cause. Then talked through home, school and social life to try to identify any stressors. But she was not too forthcoming. Patient said she did not feel stressed and that parents did not seem to care. Offered to talk to mom independently or together and to school. Talked about not using painkillers all the time. Offered referral to psychology, which she said she would think about. Feedback not clear pass as did not discuss the confidentiality and did not talk about the stress relieving methods. So the last communication confidentiality, that means maybe I can tell the teenager that before starting this communication I am to tell you what we have discussed together, that will be but just within. And how to the stress relieving methods. This can be yoga, behavior therapy, relaxing exercise, avoid caffeine, stress free. These are. Now I am discussing two communication about this tension headache for solving. Now I am discussing the tension headache. Number 1, communications. So, hello Mrs. Salma, hello doctor. I am Dr. Emma, one of the doctors here. I guess you are Adam's mummy, is not it? Yes, doctor. It is my honor to sit with a keen mom like you. Thanks, doctor. I am here to talk about Adam's headache. First, would you like anyone to be here or should we start? We can start, doctor. Tell me, how can I help you today? So, he is having this headache and increasing its frequency, severity, and I am terribly worried about him and I want to do the CT for her. Oh, I can understand your feelings. Tell me why you want to do the CT. Because it is increasing, doctor. I am so worried. It may be brain cancer. Oh, mom. I am really understanding how do you feel. But let me reassure you that after examining him clinically, there is no signs of brain cancer. He is clinically fine. So no need to do the CT. But I still wanna do it. Can you tell me why? We will ask anyone not confirming us. Then for the hidden agenda, we will ask that, can you tell me why? No reasons. I am just worried about him. Actually, she is having what we call tension headache. Did you hear about it before? No, doctor. It is the way her body reacts to the stressful situation. As you have mentioned, they have final exams after 2 weeks, isn't it? Yes, doctor. So the headache he has is the way of her body reacts to the stress. Adding to the CT is very scary experience to the child, adding to her stress and worsens her headache. Are you with me? Why CT is stressful? It is very big machine. He will be in and out many times. He has to still no moving at all, adding to this very high dose of radiation, and he doesn't need that. Okay, doctor, you can do the MRI brain. Okay, I really admire your knowledge, mom. Actually, MRI brain, there is no radiation, but it is very big machine and movement at all for 30 to 45 minutes, and some children need sleeping medicine. So this is very stressful imaging to Adam and will add to her headache. Okay, doctor, so what are gonna do? We'll give him painkiller. I already give him painkiller, but it is not working. Maybe we have a meeting with doctor who deal with what is called cognitive behavioral therapy, which means he will teach him healthy way to express her stress. Are you with me? I think you do this as we are from Middle East. No, actually, mom, we are treating all patients equally regardless their ethnic group, gender or religion. So, doctor, if you will not do it, I will complain. Mom, we are doing the best for her. No, I will complain. So if this is what you wish, I will guide you through a patient advice and liaison service, but take care only if he has any morning throwing, morning blurring of visions, nausea, or if the headache awaken her from the sleep. At this time, we may consider doing further investigation. So when any role player telling that I will complain against you, then we'll not prevent them. We'll tell about the pulse. And also the warning sign or red flag we are mentioned at the end. Then summarize websites, leaflets, support groups. Now again discussing the tension headache. There are some important points here written. So I am here to inform you that after examining Adam and doing some tests, we find that he has what we call tension headache. Did you heard about this before? Now explanations. Some people under stress can feel a constant ache affecting both sides of head, bend like it seems squeezing the head, and may feel neck muscle tighten and feeling pressure behind the eye. You mean it not real? No, it is a real ache, but I want to assure you it is simple and very common and not severe to prevent daily activities. But there are some warning signs to take care of it. So what are the warning signs of headache? If it is associated with neck stiffness, if with morning vomiting and confusion, if follow any trauma, and there any weakness on the or effective speech. Affection of speech or consider or change in behavior increased by cough or straining. These features, if happened, seek medical advice. Now, what caused this? The exact cause is not clear, but there is some triggering factor. These are stress, anxiety, tiredness, missing meal, noise, and wrong posture. How can we treat this? So, it is not severe and usually relieved by the painkiller and lifestyle changes, relaxation, yoga, exercise, message. So, when the teenager, when discussing, we telling them the management like painkiller, relaxation, yoga, exercise, and message. It is better to make a diary to identify the trigger. Also, we mentioned the diary. Avoid 4C, that is caffeine, citrus, chocolate, and cheese. You mean I give my child caffeine? No, I am not criticizing you, but some drinks and foods contain caffeine and you may don't know. Behavioral therapy and relaxing exercise. How can you know? It is simple and need no imaging. By examining her and do some tests that found normal. We are not need any imaging as there is no any warning sign. We'll mention the warning sign. I have never have headache like this and do imaging and found brain tumor. Actually, cases and conditions are different from each other. When they tell that there any never or any one affected and brain cancer come out, then we'll tell that cases or condition are different from each other. So this is all about tension headache communication. Please do subscribe and share MRCPCH with Dr. Emma Choudhury. Thank you.